Hey everyone, I'm Allison Morris watching NBC News Now. Here's what's happening.
Right now, there are troops at risk, and we are the United States military, and we fully intend to successfully evacuate all American citizens who want to get out of Afghanistan. All American citizens who want to get out of Afghanistan. They are our priority number one.
The two top military chiefs addressing the nation for the first time since the Taliban's takeover, how they plan to get Americans and our allies out of Afghanistan.
We are concerned that the current strong protection against severe infection, hospitalization, and death could decrease in the months ahead, especially among those who are at higher risk or who were vaccinated earlier during the phases of our vaccination rollout.
Third shot's the charm. The White House says COVID booster shots are on the way. Who's eligible and when? Plus, an out-of-this-world experience, a 29-year-old cancer survivor heading into orbit on one of Elon Musk's SpaceX rockets. Her inspirational mission coming up. We start today with the Pentagon update on Afghanistan. NBC News Pentagon correspondent Courtney Kube joins me now. Courtney, Defense Secretary Austin and Joint Chiefs Chairman Milley talking to the press for the first time since the Taliban takeover. Secretary Austin saying they are laser focused on the safety of Americans. What else are they saying about our military presence right now?
That's right. So there's now about 4,500 U.S. troops there on the ground in Kabul. They are securing the airport. What's pretty clear out of that briefing is the goal of securing the airport. It's not going to extend beyond that airport. For right now, anyway, if at all. They reinforce that the mission there is keep the airport safe, get Americans and Afghans to the airport, and get them out of the country safely. We now know also, Allison, that about 5,000 people have been evacuated out of that country over the course of this evacuation mission, and that's up from where it was. Remember, on Monday, the mission was pretty stalled. There was no flights were coming in or out of Kabul International Airport. Now we know that they're getting about 20 flights a day, cargo planes with hundreds of people going out now. But, you know, one thing that kind of struck me from this briefing was we heard a very personal tone from both Secretary Austin and from Chairman of the Joint Chiefs, General Mark Milley, talking about these Afghans who've been supporting the U.S. military and the State Department for 2 decades now. Here's what Secretary Austin had to say about it.
All of this is very personal for me. This is a war that I fought in and led. I know the country, I know the people, and I know those who fought alongside me. And as I said, we have a moral obligation to help those who helped us. And I feel the urgency deeply.
When he was talking about that he knows it so well, it's because he was actually the commander of U.S. Central Command when he was in uniform as a 4-star general. We heard the same thing from Chairman of the Joint Chiefs, General Mark Milley, talking about the obligation that the military has to support these Afghans who've been supporting the U.S.
Courtney, let's talk about the warning signs here about what happened. The CIA warned of a rapid collapse in Afghanistan weeks ago. That's according to both former and current officials. A senior U.S. intelligence official telling NBC News, we consistently identified the risk of a rapid collapse of the Afghan government. We also grew more pessimistic about the government's survival as the fighting season progressed. This was less of an issue of Afghan military capabilities and more a reflection of Afghan leadership, cohesion, and willpower. That said, the Afghan government unraveled even more quickly than we anticipated. What is the Pentagon saying about those warning signs and how quickly this all happened?
And that was a pretty consistent message from what we just heard from General Milley. He said several times that he didn't want to go into, he called an AAR, an after-action report now. He said right now the focus should be on getting people out safely. But he also acknowledged that there were intelligence reports that said that the Afghan government, the Afghan military could fold quickly in a matter of weeks after the U.S. left. And he made a point of saying several times that there were no reports that said that the Afghan government and military would collapse in 11 days. Here's what he had to say about that.
I have previously said from this podium and in sworn testimony before Congress that the intelligence clearly indicated multiple scenarios were possible. However, the time frame of a rapid collapse, that was widely estimated and ranged from weeks to months and even years following our departure. There was nothing that I or anyone else saw that indicated a collapse of this army and this government in 11 days.
But the reality, Allison, this wasn't an 11-day offensive by the Taliban. This offensive has been going on for several months now. And when I was in Kabul just about almost exactly a month ago, we were hearing from military commanders then that they were really worried about this Taliban offensive that was at the time already threatening Kandahar, one of the largest cities in the country. So the notion that it collapsed in a matter of 11 days isn't really reality. He did acknowledge that there were intelligence assessments that had the Taliban taking over the country in a matter of weeks, Allison.
Courtney, let's talk about what happens from here on out, right? I mean, we're less than 2 weeks away from that August 31st deadline to be completely out of Afghanistan. We know there are still thousands of people who need to be evacuated. Has the Pentagon indicated what they'll do if they can't get everyone out by then? Will the military stay on longer?
They won't say. And the reality is that's a policy decision. The Biden White House has to make that decision. I will say, we heard a stronger and more firm statement from General Milley today than we've heard from anyone else in the administration that I've heard anyway. And that he said they will get all Americans out before the U.S. military leaves and that they will work to get as many Afghans out as they can. That's the first time that we've heard someone in the administration say with certainty that they will get all Americans out. The estimates right now are as high as 15,000 Americans who may need help getting out of that country. But it's really important to point out that not all of those Americans are in Kabul. So while we're talking about this very difficult time that they're having getting through these Taliban checkpoints to the airport, I mean, that doesn't even mention the other Americans who may be in other parts of the country who can't get to the capital at all.
Yeah, Kerry Sanders painted a real picture for us yesterday of just how large this country is and how difficult it may be. I mean, people in Kabul are having enough trouble. People far from there may find it incredibly difficult to get out of the country. Courtney, thank you so much for your reporting today. We really appreciate it.
Thanks.
The first flights carrying Americans out of Afghanistan made it to the U.S. this morning. NBC News was there when they walked into Dulles International Airport. But there are still thousands of Americans waiting to come home, not to mention Afghans trying to flee the country. NBC News correspondent Julia Ainsley joining me now from Washington. Julia, one military contractor told NBC News he felt vulnerable having to evacuate. What did he say about the situation on the ground when he was leaving Afghanistan?
That's right. Jeff Gray, an American contractor, talked to my colleague, Gary Garnbach, who did the overnight shift for us, and now I get to be awake during the day telling you about it. He was one of the people who we saw come in on 3 flights from Afghanistan over the night and into the morning. A lot of these people were tired, understandably didn't want to talk to the media, but those that did really had something to say about the conditions that they saw deteriorating. This is a country where a lot of these people have been living and working for years, and what they saw astounded them. Listen to what Jeff had to tell Gary.
You feel like it's maybe the Alamo, like the last stand, like that's it. You don't have any other support elements out there like Mez, Bagram, Kandahar. All those bases had ended up closing down. You just saw basically the Afghan army kind of, retreat. So I felt that maybe there was some sort of threat, some legitimate threat, that we didn't have the backing of those other assets anymore.
He talks about the backing of those assets. Those are people, he mentions Bagram Air Force Base. He talks about, the backing of having U.S. and allied presence in Afghanistan, now unable to be there to support these people. And as they're leaving, as more U.S. military personnel are leaving, so too are these contractors. We have to remember the U.S. military were not the only Americans built around this 20-year operation. And so there are also private civilians, too, who are trying to get home to their families, not to mention some of the Afghans. And some of the Afghans may have been coming in on those planes, too. I've been told by sources Afghans were on some of the flights that have recently arrived at Dulles, but those people are instantly put onto buses and taken to places like Fort Bliss and Fort Lee in Virginia, where they can then apply for visas and figure out how they could be settled in the United States, as opposed to American citizens who can just walk outside of customs and reunite with their families.
Julia, I know it's really tough to tell how this is going to go, but do we know when, where the next batch of flights might be landing?
Well, we expect this to be, a trickle that's already starting. We expect more to be coming in the coming days. We just saw 3 overnight. There may be a few more that come tonight or tomorrow morning. But basically, each time we're seeing some Americans coming. It's easier, obviously, for them to get here, and there should be a full evacuation in that case. But in the case of the Afghans, those are the ones we're really watching for. Unfortunately, sometimes it's harder to actually see those people and count them and see how many are coming in because of that quick exodus from the airports, because these are people who have not undergone the full legal process to come to the United States. They've been vetted for security reasons, but in terms of getting those special immigrant visas that they would get for their service to the United States during the past 20 years, they now have to go through an added step of proving that. And so that's what we're watching for in the days to come.
All right, Julie Ainsley, thanks to you and Gary for your reporting.
Thanks.
Anger, sadness, embarrassment, just some of the emotions veterans of the Afghanistan war have watching the Taliban's quick takeover. Here are some of their stories.
My name is Jimmy Settle, and I was a pararescueman in Afghanistan. Whenever somebody was hurt, we were going on to go get them and get them out. I was hungry to make a difference. 2 weeks into the deployment, we were tasked to support an operation called Bulldog Bite. We're flying over the coordinates for the Americans who were hurt, and we call over the radio, hey, pop your smoke so we can identify you. And I saw 3 muzzle flashes. And I immediately knew what was going on, like we were being shot at. The bullet struck the bottom of the aircraft, fragmented, and then part of the piece went right underneath my helmet here. It's the AK-47 hole. It almost got me. While I was in Afghanistan, I got credited with 38 saves and 28 assists. And I received a Purple Heart. The very last sentence of the pararescueman's creed, these things we do so that others may live. It's a creed that I still hold close to my heart. I'm of many minds on the current events and the way they're unfolding in Afghanistan. My first thought is I'm happy we're no longer sending young, healthy bodies to be chewed up in the machine of war. However, I am really sad for the folks who are in Afghanistan and the way they're being treated. I saw a picture today of a Taliban guy wearing the helmet I wore in Afghanistan, and that was when I wore it, it was a very special, very unique helmet. So it's like, wow, how did that happen? I'm wrestling with a lot of emotions. On the other hand of the coin, I also kind of see it as like, well, the government of Afghanistan fled the country and left it to the Taliban. And my hope is that they step up and care for their people in a little bit more modern way than they were before the 2001 attacks. I can understand why people would feel that this is an all for nothing, but it was definitely not for nothing, because we were able to do some of the things that we set out to do. We killed Osama bin Laden, and he was the face of terror. I'm grateful for the security that we feel here at home today.
NBC News senior digital politics reporter Alex Sykes-Wald is here now. Alex, I know you've been speaking with veterans for your new story on NBCnews.com. Many of them frustrated, they're heartbroken, they're wondering if their sacrifices were worth it some 20 years later. Share with us, if you will, some of the stories that they've told you. What are they saying?
Yeah, Allison, well, one of the consistent things that I heard from, I think, every single veteran I spoke with was they emphasized that this was not just the product of some bad decisions in the past couple of weeks, but of 20 years. And a lot of them could point to a specific moment from their deployment when they realized that this war would be lost. And that was, years ago. One told me about a time that he got out of a convoy he was in and set up a perimeter. A man tried to cross the street with his son. The man was smiling, but the veteran I spoke to found himself pointing his rifle at this man's face, and he thought, how are we going to win the population if this is our idea of defending him? Stopping a guy, pointing a gun at a guy who's just trying to cross the street. Another told me about a time that his commander told him to blow up all the trees along a road in a village to prevent IEDs. Another told me about he went on 2 tours. On his first tour, he built up a base, and on the second tour, he tore it down because they didn't want it to fall into Taliban's hand. So they knew this was coming, a lot of them, but the speed and the completeness with which it fell was heartbreaking. disheartening. Take a listen to what Richard Allen Smith, who served with the 82nd Airborne, said.
To be frank, this sucks. It's shameful what we're seeing on TV, but again, like these mistakes were made a long time ago. It's not something that happened this week as if everything just suddenly fell unexpectedly. The mistakes that were made a long time ago. The service was in vain 5 years ago, just as much as it is now.
So a lot of these veterans, had hoped, they knew this wasn't going to end in a ticker tape parade, but they had hoped that they would have something better to take away from this. And as one Navy veteran put it to me, it feels like the why of his service is now being washed away.
Oh, it's so heartbreaking to hear them say that. Alex, you also spoke with two veterans who started a podcast about their experience. What are they doing to help other vets who are having a hard time right now?
Yeah, these were two Army infantrymen who served in the Panjwai district, which is considered the kind of spiritual heartland of the Taliban. It's where the movement first got started. They were there in 2012, and they decided to start this podcast to just tell this really narrow focus of the war. They were just going to tell the story of their company in their little corner, and it got pretty popular with service members. And so they've been getting a lot of people reaching out to them for the past month as the news has been coming in about the Taliban taking more and more of the country. And they put out this message on Facebook to these guys, telling them you're not alone. And the thing that they've been encouraging people to do is the same approach that they took with their podcast, which is to just, even if the big picture is bleak, to zoom in on your individual service. Think about what you did, the difference you made. You defended your buddies to your left or your right. You helped dig a well in a village that helped people for a while. So just concentrate on the small difference that the individuals made, even if the overall picture is so disheartening.
Yeah, they made an incredible difference, and their service most certainly counts, no matter how they feel right now. Alex, thank you so much.
Thanks, Allison.
And if you're a veteran who needs help or you know someone who does, you can contact the Veterans Crisis Line. That's 1-800-273-8255. Or you can text the number 838-255. You can also visit veteranscrisisline.net. Since the Taliban took control of Afghanistan, President Biden's only talked with UK Prime Minister Boris Johnson and German Chancellor Angela Merkel. So far, he hasn't spoken to any leaders in the Middle East. So what does that mean for our international relationships? NBC News Tehran Bureau Chief Ali Arouzi takes a look.
Hey, Alison. Well, it is somewhat astonishing that the president has only spoken to and only has plans to speak with leaders of countries that have followed America in leaving Afghanistan, both diplomatically and militarily. But it does perhaps reflect a desire in the United States to distance themselves from costly foreign interventions. But by doing so, it leaves a vacuum that U.S. adversaries are more than happy to fill and very pleased to see the back of U.S. troops in their area. There are undoubtedly smiles in Moscow, Beijing, in Islamabad and Tehran. They are saying that the Western model of liberal interventionism promoted as a means of spreading democracy and the rule of law simply hasn't worked. China is happy to see U.S. failures. The U.S. withdrawal has simply given China an opportunity to expand its own influence in Afghanistan and beyond at a time when China's rising power is starting to rival that of the United States, something that President Biden has expressed a lot of concern about. Russia has gained a lot of influence in the Middle East, especially in countries like Syria, in the absence of the United States. And even though they were humbled by the Afghans during the conflict in the 80s, they see an opportunity to return to Afghanistan, which is so strategically located. And as for Iran, this is another step forward in their desire to see the United States be expelled or leave this entire region. Just today, the presidents of Russia, China, and Iran, all adversaries of America, spoke about cooperating with one another to establish peace, security, and stability in Afghanistan now that America has gone. They are more than keen to fill that void. But the decision to cut and run is being seen as a blow to the United States' credibility, to its reliability as a partner, and indeed to its moral standing in world affairs. For European allies, it underscores how dependent they are on the U.S. and how little their views count when the United States decides they're not going to stay in a particular region anymore. And in the short term, the Afghan chaos and debacle certainly benefits the West's opponents. But what really matters are the ramifications amongst allies of the United States. What will they take away from this Afghan experience? Beyond the immediate crisis, will NATO countries, Israel, Taiwan, South Korea, or Japan see the U.S. as a less reliable partner? If they do, then this could undermine the U.S.'s standing on the world stage.
Let's go to NBC News Now correspondent Simone Boyce. She's got the latest headlines from NBCNews.com. Hey, Simone.
Hey, Allison. All right, we start with some news from Facebook CEO Mark Zuckerberg. In an interview with CBS this morning, Zuckerberg said the social media platform has identified and taken down 18 million posts containing COVID-19 misinformation. Now, he didn't say how many times the post had been shared or viewed, but he added, quote, "That's the best number that we have in terms of what we've seen." And some news out of Cuba. The nation's leading opposition leader will be heading to prison. The Cuban government ordering Jose Daniel Ferrer to serve the remaining 4 years of an assault sentence behind bars. Now, Ferrer had his original sentence commuted to house arrest in 2020 after international pressure, but Cuba now revoking his right to home detention after he was arrested in July during those mass protests on the island. And of course, many are calling this move politically motivated. And a warning for all you pet owners out there. The FDA saying products by Midwestern Pet Foods have now been linked to more than 130 dog deaths and hundreds of other pet illnesses. The agency says a recent inspection found high levels of aflatoxin, which is a byproduct of mold that can grow on corn and grains, in the company's Sport Mix dry dog food. Now, the company has not responded to a request for comment. And the TSA is officially extending its face mask requirement into January 2022. The federal order requiring masks to be worn on airline flights and public transportation was originally set to expire here on September 13th, but it's now being extended due to those concerns over the Delta variant and rising coronavirus cases. And lastly, baby news for Transportation Secretary Pete Buttigieg and his husband, Chasen. Buttigieg announcing the news on Twitter, saying, "For some time, Chasen and I have wanted to grow our family. We're overjoyed to share that we've become parents." He added the process is not quite done yet, but that they're thankful for the love and support. The former presidential candidate made history earlier this year as the first openly gay cabinet member to be confirmed by the Senate. So happy for both of them, Allison, and I am sending them all the love and caffeine in the world. They're going to need it.
Yeah, and I'm psyched to see the baby pics when those come out. Thank you so much, Simone.
Yeah.
It is now our clinical judgment that the time to lay out a plan for COVID-19 boosters is now. We plan to start this program the week of September 20th, 2021.
Another jab for Americans who got Pfizer and Moderna vaccines. The White House officially recommending COVID booster shots today. NBC News White House correspondent Monica Alba's on the North Lawn. Monica, the Biden administration saying all adults who are fully vaccinated with Pfizer or Moderna should get a booster shot 8 months after their initial vaccination. How did they make that call?
Well, it's something the Biden administration has been weighing for a couple of weeks and months, Allison, and that's because they say they saw data that does show the vaccine efficacy goes down after a certain amount of time, and they're particularly worried about the most vulnerable population, so they wanted to start the rollout, given that now many of the people who got their shots initially, we're talking in January, February, they're getting to the point where they would need that additional third dose. But it is coming with some criticism and some scrutiny because many globally are wondering why should Americans who might be healthy or doing okay when it comes to COVID already be getting another shot when so many around the world have not been able to get a first. But take a listen to how the Surgeon General explained the decision making and why they felt the time was right here now in the United States to do this.
When we look at the data, we see a reduction in protection against mild to moderate disease across age groups. We want to protect all adults in our country from the worst effects of COVID-19.
Bottom line, Allison, the top health officials today stressed that the vaccines, of course, are very safe and effective. They do prevent, in almost all cases, against hospitalization and death, but they warned that as time goes on, those vaccines might be less effective in preventing that, and that's what they want to avoid, of course, but they continue to stress that the biggest thing you can do in order to really protect yourself from COVID-19 and the dangerous Delta variant is to get yourself those shots.
All right, so Monica, people hear September 20th and they think, oh my gosh, I have to run out and get a booster shot. Who can start getting the boosters, and how is the administration planning to roll them out?
They really want to do this in order of most vulnerable population, the people who are most at risk. So those that were eligible first to get the shots are going to be the ones first in line to get these third doses next month once they become available to this sector of the U.S. population. So that's going to be nursing home residents, elderly people, and also the ones who really were able to get these before anybody else, all the healthcare workers. So they're going to be the first ones in line. But something interesting here, Allison, to remember is that once these vaccines, Pfizer and Moderna, get full FDA approval, you'd be able to get this third dose potentially in your doctor's office, or it might be a lot easier than how it currently is set up with emergency use authorization. So they're hoping that all of those groups will be able to get it very quickly and very early this fall, with all of those, maybe folks like us, journalists who got the initial shots in March, maybe your second dose in April. Then we're looking to more November, December timeframe for those third doses potentially.
Monica, how about the millions of Americans who got the J&J vaccine? I know they're not included in this.
And specifically, the guidance was if this is the shot you received, you need to wait. We're still looking at the data to see whether those who got the single dose J&J can get a third dose or what might be recommended. They said simply that right now they weren't able to make a determination, so that's something they were going to follow. Of course, the difference here is that Pfizer and Moderna are the mRNA vaccines, those two-dose regimens. So that's what they're dealing with first, and they're saying this is what those people should expect. But frankly, those who've gotten J&J are wondering what they should do, and there aren't clear answers yet, even though we have seen, Allison, a lot of reports of people who aren't waiting for that guidance from health officials. Some people are just trying to show up and get third doses when they can. The officials today, again, urging the American public not to do that. That's not their official recommendation until the time comes and until the recommendation is crystal clear, based, they said, on the science and the data.
All right, Monica Alba at the White House. Thank you. President Biden's giving an update on the pandemic. Let's listen in.
Here's Lester Holt.
Good afternoon. We're coming on the air with breaking news about the COVID vaccine booster shots. You see the president at the podium. We expect also some remarks on Afghanistan. Here he is.
COVID-19. I just got a monthly briefing from my COVID team, and here's the latest data that confirms that we're still in a pandemic of the unvaccinated. While we're starting to see initial signs that cases may be declining in a few places, cases are still rising, especially among the unvaccinated. There are still 85 million Americans who are eligible to get vaccinated or remain unvaccinated and at real risk. Across the country, virtually all of the COVID-19 hospitalizations and deaths continue to be among the unvaccinated. In Alabama, more than 90% of the current hospitalizations are among the unvaccinated. In Texas, 95% of those in hospitals are unvaccinated. Right now, it's worse in states where overall vaccination rates are low. But let me be clear, even in states where the vaccination rate is high, the unvaccinated in those states are also at risk. And we're seeing cases rise as a result. Quite frankly, it's a tragedy. There are people who are dying and who will die who didn't have to. So please, if you haven't gotten vaccinated, do it now. Do it now. It could save your life, and it could save the lives of those you love. You know, and the good news is that more people are getting vaccinated. Overall, weekly new vaccinations are up more than 80% from where they were a month ago. While it can take up to 6 weeks to get fully protected after your first shot, this increased level of vaccination is going to provide results in the weeks ahead. Just remember, We have two key ways of protecting ourselves against COVID-19. One, safe, free, and effective vaccines. And two, masks. Vaccines are the best defense, but masks are extremely helpful as well. And for those who aren't eligible for the vaccine yet, children under the age of 12, masks are the best available protection for them and the adults around them. That's why we need to make sure children are wearing masks in school. Before I talk about the news related to vaccines, let me say a few words about masks and our children. Unfortunately, as we've seen throughout this pandemic, some politicians are trying to turn public safety measures, that is, children wearing masks in school, into political disputes for their own political gain. Some are even trying to take power away from local educators by banning masks in schools. They're setting a dangerous tone. For example, last week at a school board meeting in Tennessee, protesters threatened doctors and nurses who were testifying, making the case for masking children in schools. The intimidation and the threats we're seeing across the country are wrong. They're unacceptable. Now, I've said before, this isn't about politics. It's about keeping our children safe. It's about taking on the virus together, united. I've made it clear that I'll stand with those who are trying to do the right thing. Last week, I called school superintendents in Florida and Arizona to thank them for doing the right thing and requiring masks in their schools. One of them said, "We teach science, so we follow the science." The other said, they have a guiding principle, students first. I couldn't agree more with what they both said. And that's why today I'm directing the Secretary of Education, an educator himself, to take additional steps to protect our children. This includes using all of his oversight authorities and legal action, if appropriate, against governors who are trying to block and intimidate local school officials and educators. And as I've said before, if you aren't going to fight COVID-19, at least get out of the way of everyone else who's trying. You know, we're not going to sit by as governors try to block and intimidate educators protecting our children. For example, if a governor wants to cut the pay of a hardworking education leader who requires masks in a classroom, the money from the American Rescue Plan can be used to pay that person's salary, 100%. I'm going to say a lot more about children in schools next week. But as we head into the school year, remember this. The Centers for Disease Control and Prevention, the CDC, says masks are critical, especially for those who are not yet vaccinated, like our children under the age of 12. So let's put politics aside. Let's follow the educators and the scientists who know a lot more about how to teach our children and keep them safe than any politician. This administration is always going to take the side of our children. Next, I want to talk to those of you who can get vaccinated, but you haven't. The Delta variant is twice as transmissible as the Alpha variant. It's dangerous, and it continues to spread. Vaccines are the key to stopping it. We're making progress. Today, more than 90% of seniors have at least had one shot, and 70% of people over the age of 12 have gotten their first shot as well. That's good news, but we need to go faster. That's why I'm taking steps on vaccination requirements where I can. Already, I've outlined vaccine requirements that are going to reach millions of Americans, federal workers and contractors, medical staff caring for our veterans at VA hospitals, and our active duty military reservists and National Guard. Today, I'm announcing a new step. If you work in a nursing home and serve people on Medicare or Medicaid, you will also be required to get vaccinated. More than 130,000 residents in nursing homes have sadly, over the period of this virus, passed away. At the same time, vaccination rates among nursing home staff significantly trail the rest of the country. The studies show that highly vaccinated nursing home staff is associated with at least 30% less COVID-19 cases among long-term care residents. With this announcement, I'm using the power of the federal government as a payer of health care costs to ensure we reduce those risks to our most vulnerable seniors. These steps are all about keeping people safe and out of harm's way. If you walk into a government office building, you should know that federal workers are doing everything possible to keep you safe. If you're a veteran seeking care at a VA hospital, you should not be at a greater risk walking into the hospital than you were outside the hospital. And now, if you visit, live, or work in a nursing home, you should not be at a high risk for contracting COVID from unvaccinated employees. While I'm mindful that my authority at the federal level is limited, I'm going to continue to look for ways to keep people safe and increase vaccination rates. And I'm pleased to see the private sector stepping up as well. In the last week, AT&T, Amtrak, McDonald's, they all announced vaccine requirements. I recently met with a group of business and education leaders from United Airlines to Kaiser Permanente to Howard University. We're also doing the same thing. Over 200 health systems, more than 50 in the past 2 weeks, have announced vaccine requirements. Colleges and universities are requiring more than 5 million students to be vaccinated as they return to classes this fall. All of this makes a difference. The Wall Street Journal reported the share of job postings stating that new hires must be vaccinated has nearly doubled in the past month. Governors and mayors in California, Maryland, Massachusetts, New York, Oregon, and Washington have all announced vaccination requirements. So let's be clear. Vaccination requirements have been around for decades. Students, healthcare professionals, our troops are typically required to receive vaccines to prevent everything from polio to smallpox to measles to mumps to rubella. In fact, the reason most people in America don't worry about polio, smallpox, measles, mumps, or rubella today is because of vaccines. It only makes sense to require a vaccine that stops the spread of COVID-19. And it's time for others to step up. Employers have more power today to end this pandemic than they have ever had before. My message is simple. Do the right thing for your employees, consumers, and your businesses. Let's remember, the key tool to keeping our economy going strong is to get people vaccinated and at work. I know that I'll have your back. They should know I'll have their back, as I have the back of the states trying to do the right thing as well. For example, yesterday, I instructed the Federal Emergency Management Agency, FEMA, to extend full reimbursement through the end of the year to state deployments of National Guard in support of COVID-19 response. Nearly 18,000 National Guard members are supporting our response nationwide, from caring for patients to administering vaccines to running testing sites to distributing supplies. As the states continue to recover from the economic toll left by COVID-19, the full reimbursement of National Guard services during this pandemic will be another tool that will help them shore up their budgets, meet the needs of their communities, and continue our economic recovery. These are the latest steps we're taking to get more people vaccinated. Next, I want to speak to you all of you who are vaccinated. How should you be thinking about the moment we're in? First, know that you're highly protected against severe illness and death from COVID-19. Only a small fraction of people going to the hospital today are those who have been vaccinated. But we have a responsibility to give the maximum amount of protection, all of you the maximum amount. Earlier today, our medical experts announced a plan for booster shots to every fully vaccinated American, adult American. You know, this will boost your immune response. It will increase your protection from COVID-19. And it's the best way to protect ourselves from new variants that could arise. The plan is for every adult to get a booster shot 8 months after you got your second shot. Pending approval from the Food and Drug Administration, the CDC's Committee of Outside Experts will be ready to start this booster program during the week of September 20, in which time anyone vaccinated on or before January 20 will be eligible to get a booster shot. So that means that if you got your second shot on February 15th, you're eligible to get your booster shot on October 15th. If you got your second shot on March 15th, go for your booster starting November 15th, and so on. Just remember, as a simple rule, 8 months after your second shot, get a booster shot. And these booster shots are free. We'll be able to get the booster shots at any one of approximately 80,000 vaccination locations nationwide. It will be easy. Just show your vaccination card and you'll get a booster. No other ID, no insurance, no state residency requirement. My administration has been planning for this possibility in this scenario for months. We purchased enough vaccine and vaccine supplies so that when your 8-month mark comes up, you'll be ready to get your vaccination free, that booster shot free, and we have it available. It will make you safer and for longer, and it will help us end the pandemic faster. Now, I know there's some world leaders who say America shouldn't get a third shot until other countries got their first shot. I disagree. We can take care of America and help the world at the same time. In June and July, America administered 50 million shots here in the United States, and we donated 100 million shots to other countries. That means that America has donated more vaccine to other countries than every other country in the world combined. During the coming months of fall and early winter, we expect to give out another about 100,000 boosters, and the United States will donate more than 200 million additional doses to other countries. This will keep us on our way to meeting our pledge of more than 600 million vaccine donations, over $500 million. As I said before, we're going to be the arsenal of vaccines to beat this pandemic as we were the arsenal of democracy to win World War II. So let me conclude with this. The threat of the Delta virus remains real, but we are prepared. We have the tools. We can do this. So all those of you who are unvaccinated, please get vaccinated for yourself and for your loved ones, your neighborhood, and for your community. And to the rest of America, this is no time to let our guard down. We just need to finish the job with science, with facts, and with confidence. And together, as the United States of America, we'll get this done. God bless you all, and may God protect our troops. Thank you.
President Biden taking no questions, but echoing what we heard earlier today from federal health officials about a third dose, or what's being referred to as a booster dose, will be necessary for most Americans who receive the Moderna or Pfizer vaccines, the full dose going in line beginning in late September. Let's go to Dr. John Torres right now. Dr. Torres, a lot to unpack here. Surely a lot of people will have questions about this booster plan. Can you frame it for us?
Exactly, Lester. And the main point here is he's saying 8 months after you got your second shot, which means Pfizer or Moderna vaccines, you need to go ahead and line up and get your shot. But he did mention to bring your vaccination card with you. So you want to make sure that you have that. And that's going to start September 20th. And so, again, like he mentioned, if you got it in January, you get it in September. If you got it in February, you get it in October. It follows sequentially. And then what they had said earlier, he didn't mention this, but Johnson & Johnson vaccines, at the time being, they are looking into that to decide what they want to do with that. But he's pushing people to get this booster, saying, which is true, that you are safe from severe illness, hospitalizations, or death with what you have now, but we want to make sure that you're even more protected with this booster, Lester. All
right, Dr. Torres, thanks. Joining me now, NBC News contributor Dr. Kavita Patel. Dr. Patel, if someone was only half listening here, they might think that the current vaccine is not effective. Can you put it into perspective what they're seeing in it and why they want to do this third dose?
Yeah, Lester, we need to reinforce that the message is that the current vaccines are working, as the president stated. What they have seen in the data from Israel as well as the United States is that our immunity decreases over time, and that in some places, Israel being one of them, they noticed that they saw an uptick week over week with the Delta variant in hospitalizations amongst the vaccinated, dramatically less than the unvaccinated, which is why I think the administration has to walk a fine line here. They don't want it to sound like the vaccines are not working, because they are working. But think of this as a way to, you don't want to wait until the hospitalizations and deaths increase here, Lester. And we're seeing concerning signals from long-term care facilities, nursing homes, which is why I think you saw Biden emphasizing that anybody in a nursing home who is a Medicare or Medicaid patient will have a vaccinated staff around them. And I think that's essential.
Yeah, an effort to certainly get ahead of where we are. Dr. Patel, thank you. NBC News White House correspondent Peter Alexander is here. Peter, your thoughts and observations?
Well, I think Dr. Patel just made an interesting point there, which is that the president, who in the past has really held back, he's been reluctant to threaten withholding federal money to compel organizations throughout this country to mandate vaccinations, did just that today, saying that he is going to order those nursing home staff to get vaccines, certainly those nursing homes where they receive Medicare or Medicaid money, because, as he noted, 130,000 nursing home residents have lost their lives in the course of this pandemic so far. As it relates to that booster shot, the beginning date would be September 20th, beginning 8 months after those who have received their second Pfizer or Moderna shot.
Peter Alexander at the White House. Thank you. We'll have much more on this developing story this evening on Nightly News. For now, I'm Lester Holt, NBC News, New York. Good day, everyone.
It's time for The Bottom Line, our daily look at what's going on in the business world and beyond. Today, we're checking out the restaurant industry. With comfort food taking over, will we ever want white tablecloth, dining again? According to NBC News senior business reporter Ben Popkin, the pandemic hasn't killed fine dining, but it is forcing it to evolve. Ben joins us now. Ben, in your story, New York Magazine food critic Adam Platt told you life is coming back to the dining ecosystem. So what signs of life are we seeing, and how are restaurants, especially the finer ones, adapting to this new food order, if you will?
Well, Delta concern is starting to put a damper on everything, but up to now, tables have been full, reservations booked long ahead, and people have been flushed with vaccines and stimulus cash. They're going out, they're eating up, and they're splurging on fancier drinks, more expensive items. At the same time, fine dining restaurants, they've been coping, Allison, with not enough staffing, like so many restaurants and businesses, cutting lunch service, staying closed Mondays and Tuesdays. They're pivoting. They're offering high-end to-go boxes, video cooking classes, and it looks like those sidewalk cafes and structures, they're going to be sticking around.
So, Ben, how about outside the U.S.? You're reporting fine dining around the world is back and booming as well.
Right. Overseas, across the pond in London, it's like Christmas every day for restaurateurs, food critics tell me. Reservations booked months in advance. Bills are up. People really have had nothing to spend on except Amazon, so they're going out and treating themselves.
Yeah, it seems like we all have been funneling a little bit too much of our money to Amazon deliveries. But let's talk about what we're seeing on the lower end of the food chain. Applebee's planning to add more drive-thrus to cater to this new desire for drive-thru and delivery. Mm-hmm. What other changes are happening over at the fast food giants?
Well, the pandemic forced all these fast food places to really quickly compress their development and deployment cycles. They've been aggressively making investments to capture that spiking demand, and that's drawing even more customers their way. So we're seeing fast casual king Applebee's. They're planning to add more drive-through lanes. Wendy's and IHOP are eyeing potential ghost kitchen concepts. These would be establishments that are set up and are delivery only. McDonald's, other fast food chains, they're pushing, instead of value meals, these pricier $10 to $30 combination meals to really capture those families looking to get those family meal deals.
We got retail sales numbers for July this week, Ben, and they were disappointing, but they weren't for restaurants. Sales at eating and drinking establishments were up over 38% year on year. So what does that tell us about the industry? Are things going to be okay?
Well, it looks like people want to dine, but they don't want to shop quite yet. There's really this robust appetite for dining. people, they want to feel good, see other people, and have someone else cook for them instead of cooking for themselves and their families 3 times a day. So with that stimulus and savings and wage growth, they've got cash to burn. But like I said, Delta already starting to put a damper on some of these things a bit. The in-person restaurants, they're saying about a 20% drop off. Once again, the virus deciding what's on the economic menu.
Yeah, Ben, I have to say, though, I'm right there with them. I had a salad on Monday that someone else made for me, and it felt like such a treat. I think we've all been eating at home a little more than we would like to. Ben Popkin, thank you so much. One woman's dream about to take off. Years after battling bone cancer, Haley Arsenault will be one of 4 crew members on a SpaceX trip into Earth's orbit. Today, anchor Hoda Kotb has her story.
For 29-year-old Haley Arsenault, life has always been about beating the odds. When she was just 10 years old, Haley was diagnosed with bone cancer, becoming a patient at St. Jude Children's Research Hospital. After chemo and surgery to install prosthetic bones in her left leg, Haley left St. Jude with a dream.
What are your dreams? What do you dream about?
I want to be a nurse at St. Jude.
19 years later, Haley's dream became a reality when she was hired by St. Jude as a physician's assistant in their oncology unit. But for all those years, Haley was holding on to another dream, too.
A few months before I was diagnosed, my family went to NASA in Houston. And of course, I wanted to be an astronaut after I went there.
Now, Haley is less than a month away from reaching her dreams of space. She's one of 4 crew members on the Inspiration 4 team, occupying a seat donated to St. Jude by mission commander and billionaire Jared Isaacman. The team will take off on one of Elon Musk's SpaceX rockets for the first all-civilian trip into the Earth's orbit. Haley chronicling the team's preps online, including a test of zero-gravity flight, fighter jet training in Montana, and even signing the rocket that will take her and the team to space.
Right now, I just feel nothing but excitement and the good butterflies.
After she was named to the flight, Haley told Today her most important mission is being an example for children fighting cancer, showing them that their biggest dreams can come true, too.
I can't wait to talk to my patients about this and just to show them that they don't have to limit themselves because they can really do anything.